Esteemed audience, ladies and gentlemen, thank you for joining us today. It is the first edition of our remote, interactive and virtual roundtable on pandemic prevention and preparedness. This event has been initiated and launched by MCI and Dorier. If some of you may not know what MCI does, it is an independently owned agency headquartered in Geneva in Switzerland and globally present in over 30 countries. For several decades now, MCI has empowered associations, companies and brands to activate their employees, partners, customers and members. They accomplished this by creating face-to-face, hybrid and digital events. My name is Katrine, or you may call me Kate, and I have the honor to be your moderator for the next about 90 minutes. But first, let me switch over to Nissan Batov of MCI, who is leading this PanPrev project with his whole heart and knowledge of conventions. He surely best can explain why and how it came about. Nissan.
Thank you, Kate, and hello to Geneva, and also thank you for all our participants, and a big thank you, of course, to all our speakers. Well, Kate, I have one good and three bad news for you. What do you prefer first?
I choose the good news, please.
So the good news is that with the experience of COVID-19, we have today all the tools to prepare ourselves for the next pandemic. But the bad news is, one, we are still not ready to cope. Two, pandemics cannot be prevented, and the next pandemic is already around the corner. We started with this idea of PanPrev about half a year ago during the first lockdown. We were asking ourselves, what if we will not recover before the next outbreak? We believe that this current COVID-19 crisis is only a wake-up call for the next, much more severe pandemic outbreak. When this will happen, we cannot tell, but for sure it will not take another century, more likely only a few years. As a matter of fact, this depends only on us and on the conclusions we will take from this COVID-19 crisis. So I hope that with this PanPrev initiative, we can encourage a global discussion to help us to properly prepared for the next time. Back to you, Kate, back to Geneva, and enjoy the show.
I hope so too. Thank you very much, Nissan. So, are we prepared? What have we learned from this COVID-19 crisis, and what are the long-term impacts of a pandemic such as COVID-19 on our economy, our social life, and our health? In fact, today, more than half a year since the global breakout, we are still not able to define the new normal. Maybe we won't even be able for a long time to come. Can we improve our preparedness by identifying potential future pandemics and better react or even prevent their outbreaks? To do so, we first need to understand why COVID-19 happened, although there were very clear warnings and signs announcing it. It seems there is a need for a strong international collaboration between different interest groups such as science, politics, economy, technology, global health, environment and logistics, just to name a few, to frame new global standards, protocols, action plans and, very importantly, redefine our economical values. Perhaps the most important key to avoid future outbreaks and to be better prepared is sustainability. Led by their dedication to sustainability, MCI is contributing with this project to take an active role on pandemic prevention and preparedness. This happens together with all their global offices and key opinion leaders from all sectors who have been working with MCI closely over the past decades. We would like to invite you now to join us and take an active role via Slido. I have the great honor now to welcome our first guest, Professor Bettina Borisch. She is as passionate about the field of pathology as she is about the public health sector. Bettina, great having you.
Thank you. And thank you for the passion. I'm passionate about health, and I'm working at the Institute of Global Health as a professor at the University of Geneva. And in addition to that, I'm the executive director of the World Federation of Public Health Associations.
How big is this association?
Our association represents over 100 national public health associations, and this means over 5 million public health professionals worldwide.
Global health is in everybody's mind right now, and mindset hopefully soon. We talk about this as well. But please tell me first, what is the general role of global public health, and in particular during this COVID-19 crisis we're facing today?
The interesting thing is that I was frequently asked, what do you do at Global Health? This was before the crisis. Now nobody asks me anymore. I think we had a very, very big and fast learning curve worldwide that made us understand that health is a political, economical, and global issue. And everybody has understood it, I think, nowadays. So we are working on advocacy, on policy. We work with governments, civil society, with the public health workers on the ground, and try to improve the health of populations.
Improving the health of populations, what a goal, what a challenge. Thank you so much for all your insights and introducing us to the field of public health. Let me now introduce you to Ali Mobasheri, who is with us virtually. Please, Ali, introduce yourself and tell us what you do.
I'm Professor of Musculoskeletal Biology at the University of Oulu in Finland. I also have the position of Chief Researcher in the State Research Institute for Innovative Medicine in Vilnius in Lithuania. And I also have a fractional position at University Medical Center Utrecht in the Netherlands. And my area of research is cartilage biology and osteoarthritis research. So I'm not clinically qualified, but I am a basic scientist. I'm a biochemist by training, and I did my PhD in the area of molecular physiology at Wolfson College in Oxford, and I spent the last 20 years investigating basic aspects of cartilage biology, chondrocyte physiology in the context of osteoarthritis, which happens to be the most common form of arthritis globally. I'm also president of the Osteoarthritis Research Society International, which is the main society and organization solely dedicated to the study of the pathogenesis, epidemiology, and molecular mechanisms involved in osteoarthritis. And the aim of the society is to bring together scientists, clinicians, and industry partners to tackle this problem for which there are currently no drugs.
Ali, could you please introduce us to the concept of One Health?
So One Health, there are lots of definitions for One Health. If you look, if you search for One Health and definitions on Google, you'll find numerous different definitions. But the way I would define it is the intersection between human medicine, animal health, environmental health, all of these different disciplines intersecting. So it's really a collaborative, multi-sectorial, transdisciplinary area where you could have impacts at local, national, continental, global levels. And it's really about the health of human beings, the animals that we depend on, domesticated, food-producing animals, wildlife, as well as the environment. So impact on one particular element within this, this system is going to have impacts on the others.
Thank you for sharing your views, Ali. It is so interesting also to gain insights from your field of science. And now to a different field, the field of economy. I have the great pleasure to welcome Ludovic Subran, Chief Economist of the Allianz Group. Welcome, and thank you so much for taking the time to be with us today. May you please introduce yourself to our audience.
So I'm Ludovic Subran, and I'm French, as you can hear, and I'm the Chief Economist of Allianz, which is the largest insurer and investor in Europe. We're based in 74 countries, but we operate from Munich. Before that, I worked for the subsidiary of Allianz that deals with trade credit insurance called Euler Hermes. And before that, I spent 10 years in the public sector at the French Ministry of Finance, the United Nations, and the World Bank. And I'm very delighted to be here today with you.
So, Ludovic, did the insurance companies expect the outbreak of a pandemic like COVID-19?
Well, we expected that 2020 would come with a recession in the US. We were worried about the fragmented world before COVID and what it could mean for trade, for regulation, for the tech world, etc. So we were concerned about, the pre-existing conditions and vulnerabilities of this world, but we had no clue. I think the first time I heard about COVID was from my economist from China, who mentioned that in December. She said, there is this virus, airborne virus, and people are concerned that it could be a repeat of SARS, but it's very localized. It's in Wuhan, it's in the Hubei province, it doesn't touch Hong Kong, Shanghai, so we heard of it, so we had it as a low signal. But have we predicted that it would become this massive game changer? No, definitely not. And so, as the crisis unfolded, we saw first the trade shock, because we, Allianz operates from across the globe, but we have most of our, profits and revenue come from Europe. So we first saw the export shock, the trade shock. Then we saw the financial market shock. And then we saw the seclusion shock, the decision by government to strictly lock down half of the population, 3/4 of the GDP. And that's when, we had to really run the models. Most of them were not fitted to this type of shock, and try to understand what was happening. So it was really like, something that came in slow motion our way, but we turned a blind eye.
Thank you, Ludovic. A shocking situation indeed to grasp. Nevertheless, it is so good to hear that a person like you, who likes to crunch numbers, is speaking so much about the importance of human well-being. I have now the great pleasure to welcome Cobi Reisman. He's with us from Amsterdam. Cobi, welcome. Could you introduce yourself, please?
Yes, thank you for inviting me. I'm Cobi Reisman. I'm a urologist and sexologist, mainly work in the field of sexual medicine. Among others, I was till recently the president of the European Society of Sexual Medicine, responsible for the education of sexologists in the Netherlands, editor of a few textbooks on sexual medicine and clinical sexology.
Please, Cobi, tell me a little bit about what is your field of passion? What's your focus? What are you, really looking at in your field?
Mainly, my field of focus is making patients happy. to say it shortly, because mainly I worked in the hospital and I see a lot of patients with chronic disease or with cancer. In the beginning of my career, I was focusing on treating diseases. And now I'm more focusing on treating the consequences of diseases. And when we talk about chronic diseases or cancer, patients suffer for a long period of time with impact of the disease or the treatment on the quality of life. And one important aspect of quality of life that a lot of people don't dare to speak about is sexuality and intimacy. Unfortunately, patients don't dare to talk about it or to start the conversation about it, and healthcare professionals neither. So what I'm trying to do is break the taboo, make people to start communicating about these issues. In the couple is very important, and they don't always dare openly to talk about it and explore their intimacy. In some moments during the relationship, intimacy take even more important place than the sexuality. And a lot of people mix intimacy and sexuality, but actually they are not the same and they are connected to each other. And you can have marvelous sex without intimacy, and you can have intimacy without sex, but in a lot of cases it's going together. And physical intimacy is something that's very, very important for us as from physical point of view, but also from psychological point of view.
Our speakers gave us much to think about indeed. Health has become all the more a political, economic and global issue, and with it all the factors influencing the well-being, interactions and thus functioning of nations. Preventing pandemics and preparing for them has all the more become an interdisciplinary challenge for science but also societies. Let us open our eyes to the value and necessity of global human health, of a protected global community of safe ways to meet and exchange. Let us look now at COVID-19. What does especially this pandemic teach us?
Ladies and gentlemen, friends and colleagues, let me give you a stern warning. What we are seeing now looks more and more like a dramatic resurgence of the threat from emerging and re-emerging infectious diseases. The world is not prepared to cope.
So why weren't we prepared, Bettina?
Well, the occurrence of this pandemic was foreseen by science, by WHO, by all the organisms. It has been clearly described and foreseen for a long time. And now we come to the question like health. If a population is in good health, they don't think about a crisis. Also, crises of this kind usually happen somewhere in the developing world. So some people in the Western world thought we will never get it. And we have learned that we can only be healthy all together. Even very rich countries have had to learn it the hard way. Take the example of Singapore. They were very well out of the crisis, but forgotten about some migrant workers. You cannot have half of the population being in bad conditions. We all have to live in good conditions, healthy conditions, otherwise the whole population gets ill.
Ali, what's your opinion? Why has this pandemic surprised us as much as it did? The threat of a new coronavirus was first mentioned in 2007, wasn't it?
That's a great question. I believe you're referring to a paper that was published in 2007 by a group at the University of Hong Kong.
Yep, exactly.
Predicted this. It's absolutely remarkable. If you read the paper, on the first page of the paper, the authors say that the presence of a large reservoir of SARS COVID-like viruses in horseshoe bats, together with a culture of eating exotic animals in the southern part of China, is a time bomb. So here they are, they're in Hong Kong, they know their area of research extremely well, they know what's going on right across the border in China. They predicted this 13 years ago. They actually said this time bomb is going to explode soon. They said this 13 years ago. Why didn't we listen? If you look at the paper that was originally published, it's a beautifully written review that gathers all the evidence and weighs up all the evidence. How much was that paper publicized? How much was it discussed by the media and the public? Nothing. It was written for the scientific community. It was an expert paper, review article, written by a highly expert group of scientists, but it was written for their peers. We didn't see evidence of that paper being disseminated to the press, the public, schools, etc. So now we find it in the literature because we can use keywords, and they clearly warned us that this would happen. But the paper wasn't further disseminated. So we didn't get the opportunity to get that message across to politicians. So that's what happened.
Bettina, how do we avoid a next pandemic? And if we can't, how do we best prepare for it?
There are two kinds of preparations. One is the specific preparation for a pandemic. That means you have to have a good health system in place. I don't say directly health care. Health care is also important, but you also have to have the system in place that is able to detect, to track, and to follow up. Because as we have seen, this is a very important part, still is now. And then you have to have a good health care system in place. And this has to be universal health coverage. That means everybody in the country must have access without financial burden to testing, to treatment, and so forth. This is one thing. What we do not really look at now is that we have to prepare population's health in general. You heard about people at risk during the crisis. And these were who? The people with chronic diseases. So we have to make sure that chronic diseases such as diabetes, cardiovascular, and so forth are not increasing as they are, but that we also keep them lower or less important, because every next infection would be more difficult and more dangerous for those who already have a chronic disease. So we have to work on the acute and we have to work on the chronic. They both come together.
So it doesn't matter the age of the person at risk?
This was a very interesting thing during this crisis. We as public health people followed it. There was this saying, people above 65 are at risk. We know in medicine that you have to look at the biological age. Your passport age is one thing. And I think it's also very bad from a societal aspect. You should not split societies into above, under, elderly, risky ones, those with glasses, those without glasses, those with fair hair, and this with dark color. If you start splitting, then you will have a problem, and a health problem for the whole society. So I think we have to learn how we deal with the question also of age and ageism.
Such important topics, Bettina. Thank you very much. Today's discussion will focus on global health, One Health, social impacts, and the world economy. This first half was dedicated to providing you with some insights and information by our experts, which you may have not heard before. For the second part of this roundtable, we invite you to take an active role and be part of the discussion with our panelists later via Slido. Let me give you some instructions for our Q&A with Slido. You may download the application for free from the Apple Store or Google Play Store if you haven't done so. Or you join us at slido.com using the following event code. It's 40705 4075. The passcode is ICPPP. Alternatively, most smartphone cameras will recognize the QR code in the confirmation email. You are directed to the proper web page where you will have to enter the passcode ICPPP and your username. We will now show you the QR code. Scan it with your mobile phone so you have the access to the questions on your device already. This helps avoid with the streaming delays. Thank you. We do look forward to your votes and later reactions, questions and comments. Let's start with poll number 1. In your opinions, what will change in our social behavior post-COVID-19? Please take out your smartphones, go on your website, let us know what you think. Please take your time, but not too much. You have about 1 minute to vote. Cloud, lots of points coming in. A lot is about suspicion. Pretty much everything. That is the main word. Actually, people are looking at. So we're actually very, very interested in what everything means, and I guess we're learning a lot about the everything and travel points later on from our experts. Let's move to poll number 2. If you would exhibit COVID-19 symptoms yourself, to what extent would you inform the people around you? You have another 30 seconds to vote, maybe a minute, and let's go for it. Let us know what you think. Would you exhibit, if you exhibit COVID-19 symptoms, would you inform the people around you? Okay, give it another 10 seconds. Thank you so much for your votes. Good to see that everybody would be open to inform the people around themselves. So finally, the last poll for this part of the roundtable before we move on to our next speaker, Cobi Reisman. So your opinion, to what extent do you believe COVID-19 will change our social life in terms of social distance, handshaking, welcome hugs and kisses, sexual life, etc.? You have about 30 seconds to vote. Please vote now. So the people thinking that our life will be the same before COVID-19 and some behaviors will return definitely are in the forefront. But also there's quite some people who think that anything will be as it was before. So let's see what our experts say. We're going to play the results back to our experts in the last part of our roundtable, the panel discussion. Thank you very much for voting. You have the chance to vote again later on. So now to a different point of view, the one of Dr. Cobi Reisman, urologist and sexologist in Amsterdam. Welcome, Cobi. Cobi, are we on the right track and are there any words of relief for this new normal?
It's not one person that and it's going the right direction, at least in Europe nowadays. We still need to be careful. But there is no problem to get intimate and physical with each other when you live in the same house. So for the people in a relationship who are living under the same roof and both of them are feeling well and have no signs of flu, of COVID, they can be intimate. That the quarantine caused to some patients to some people, let's say, sorry, not patient, a problem situation concerning sexuality is obvious because, as I said, there is a lot of stress, increased anxiety disorders, increased signs of depressions, but not for everyone. From the data that now are valuable, we know more or less that about, let's say, 1/3 of the people had increased sexuality, 1/3 had less sexuality, and 1/3 stayed the same. So the people react in different ways for the same situation. In any case, the people who have problem on sexuality and intimacy nowadays are the singles. Because they had less opportunity to meet new people, to engage in sexual activity with each other or intimate activity with each other, and they face a challenging situation. So you saw that there is much more sexting and virtual contacts between people and those issues. But even then, not everyone obeyed the rules because we are humans. We don't always obey the rules. So that makes change, and I hope that with the time coming and that treatment or vaccination will be available for COVID, we will go back to the regular life where personal contact, physical contact will be available for a lot of people, and this is very, very important.
Is the new normal? Are we able? That's exactly what I wanted to know. We have to cope with the new normal, which which the crisis develops in. Are we able to change to adopt new behaviors in that short time? Because it really hit us like out of nowhere.
Majority of the population adapt very well for these new rules, and I try to avoid to call it the new normal. It's temporary, and I hope that it will be temporary. And please don't use it as a new normal, because people will start to accept it as a normal, and it will be difficult and it will be problematic. And I will try to explain why. Touching each other, and I'm not talking only about shaking hands, that's we can find a new other way, but touch is a very important sense. For us humans, it's, I think, the less developed sense in the last centuries. We use very well our eyes and our ears and our smell, which are also protecting, and our taste, but touch got less attention. But there is a lot of scientific data about the positive effect of touch, the importance of touch. There is even in Florida and center that do very good scientific research on the importance of touch. And we know it already from the experience of Harlow with the monkeys a long time ago, which are very weird tests, that touching each other is even very important for children, for young children. Just to give an example, when you touch each other, there is even release of some mediators in our body, like dopamine, of serotonin or oxytocin, and these have impact on pleasure, satisfaction, even motivation. Cortisol reduce stress response, and it is not for nothing that we develop the custom that when someone is sad or stressed, the other one give a hug or put an hand on the shoulder and say, don't worry, we will support you, those issues. So nowadays we do it less and less because of the COVID. So we try to stay in positive communication, but even this positive communication in a lot of cases is in distance. And this is very difficult, because if we will have lack of positive touch, certainly there will be some impact on children, like on cognitive and development delays, and the need for attachment. There is certainly impact on fear or depressive symptoms, and not to forget there is even evidence about the impact of positive touch on our immune system. So we need it, our body and our mind need it. So let's not make it normal. Let's make it a temporary situation. And I hope that in months' time, we will have a available control measurement for the COVID, which are not quarantine and not isolation, but vaccination of a treatment, and we will be able to come to the normal contact.
So is there, in your opinion, an opportunity to prepare yourself for maybe a next pandemic that is around the corner, even if it's only the second wave?
Prepare yourself is try to stay as healthy as possible. That's what we can do. Be aware that in some situation we will need to adapt to stress and fears. And in that respect, trying to build intimate relationship with your surrounding, with open communication is very crucial. And open, intimate communication, it means that to dare to build a connection on trust and that you can share authentic feelings with each other. That is important in the couple, in the family, with your friends. That will support, I think, and help to overcome a situation of stress, crisis, fear.
And creates resilience.
Yeah.
Yep.
That will be important. And again, try to stay in a good physical condition and mental condition. Not all of us are able or have the luck to have it.
Ludovic, let us talk about your perspectives. Having an in-depth overview of national and global economics, we wonder what impact for change has COVID-19. So you surveyed risk managers around the world last year. What did they tell you, and did they see the pandemic coming?
Yes, so I mean, COVID-19 is a black swan, or at least it's something that for the insurance world is always on top of our list, because it is, a high impact, but low likelihood risk. Actually, in Allianz, we surveyed risk managers across the globe at the turn of 2019-2020, and we asked them what are the top risks. And they basically gave us whatever you could find on the headlines of the Financial Times, but the pandemic risk was number 17 or even 18. So it was really not on the front burner. And it is the case of most of the risks that are probabilistic, systemic, and exponential. Climate change, of course, is one of them. And I think COVID is, to a certain extent, very similar to climate change in the sense that most risk managers know that this could happen, disrupt supply chains, disrupt the risk environment, their investment environment, disrupt the way they work. But you rarely prepare, or you don't prepare enough for such events, because it is, something that happens once every century. And it is something that, in that specific case of COVID, triggered very specific response by governments for which we were even not prepared. I think that was one of the big lessons of COVID, was not necessarily the uncertainty stemming from the epidemic itself, but the policy response that came with it. The fact that central banks, that ministries of finance decided to respond in an extraordinary way, but also the fact that, stringency of lockdown made countries get their separate ways very early on. And even today, the way a second wave could be managed is something that is, that is a strong assumption in the way we see the recovery. because we're learning from our lessons. I think for most of the Western world, this was the first epidemic in quite some time, compared to Asian countries, where the SARS epidemic was not so long ago, so they were rather prepared to basically test, isolate, treat, track. We've struggled with that a bit in the West. Some countries like the UK, the US, and Brazil are still struggling as we speak. And so as a result, the economic impacts, or at least what we tried to take as decisions as Allianz, was to be able to operate in a very volatile financial environment, try to understand that we're going to have to operate in a different business model when it comes to the way we sell our products and services, the way our people produce, or do their job every day. And so that was the type of things that we grasped very early on and tried to diffuse in the organization, so that we would be, I think, ready for the first very acute phase and the unprecedented recession, which is twice as severe as the financial crisis, but also ready with the marathon, that is the second phase, this twilight zone, which means that till we find a vaccine, we're going to have to live with the possibility of wavelets of COVID, light lockdowns, and even more erratic policy reactions that would trigger different behaviors by companies, by households, by markets. So this, preparing them to grasping a bit of rationality in the very irrational behaviors that we've seen from across the world is something that we have been very early on, conveying as a message, and trying to also point to the differences, because everybody thought, it's a pandemic, so everybody's affected in the same way. And actually, it's very different. If you're in the air transport sector, if you are in the agriculture sector, if you're in the construction, the retail, it's very different if you are in the US or if you are in Japan. It's very different if you are rich or if you are poor. It's very different if you have strong states or weak states. And if you are an exporting country or if you are a financial hub. And so giving this sense of, the 50 shades of impacts of the pandemic was really what my team and I really focused on over the past 3 months, and continue to.
Ludovic, is there actually a second wave coming? And what does it look like? How can we actually cope when it's there, or is it already there?
For sure, we're going to hit the second wave, which is the wave of bankruptcies and joblessness. So, governments have been trying to mitigate the consequences of the recession, but in effect, a lot of people will lose their job over this crisis. A lot of businesses will never get back to normal. And so we have to understand and to continue to support those that are in the most difficult situation. And so that's unfortunately why it is a marathon, and why the acute phase of the epidemic shock is just one phase in a series of domino effects that this crisis will have on the economy, on our behaviors, on who we are, and how we behave collectively and individually. So the big risk is, of course, that this pandemic becomes an endemic, and that we have to seclude and reopen and seclude and reopen. People have in mind what happened in the second part of the 19th century in the Ottoman Empire, where plague and cholera were endemic, and where the GDP was, cut every other year by 20%. And so people want to avoid this. I think we are lucky to have medical innovation, at our doorstep that is there to fight this risk. But economically, we will not be unscathed by how far fiscal and monetary policy went to respond to this crisis. And I think, if I look at what Europe is trying to do, Europe is trying to build back better, build back greener, build back leaner. So there is a bit this, realization that some of the excesses from the past cannot be, brought with us into the world after COVID. I'm very realistic and pragmatic. I don't believe that there is, the kumbaya of, after COVID, new life, everything. I don't believe in that. But I'm sure that the fact that this shock was collective is going to change behaviors, and that we understand also better what it means to have a shock similar to climate change. And that, these shocks that look far could actually become much closer to us, and we have to act now, and we have to be prepared, and we have to look for collaborative solutions, and not, a pandemic doesn't stop at the border of one country. We also learned that. So I believe that there will be some improvement in the way we collaborate, in the way business behave, in the way we think about public goods, health, education, the planet after COVID. But it is a long shot. And there will be many mistakes. So we need to be patient, allow for failure, because we won't get it right the first time. Changing our business model, changing the rules of the game is something that is not, hard science. It's not perfect. It's not right or wrong. It's about getting it right. It's not about being right. And so we just need to make sure that, unlike the financial crisis, we don't forget it too early. And that we, unfortunately, from what I can see from the health numbers, it looks like we may actually have a bit of a longer time to live with the virus. But I really wish that we take the time to draw the lessons, and we act on the impact of the crisis in a very gradual manner. So no overpromising and under-delivering. No, we're going to be magically all better and all better together, and everybody's going to work from home, and it's going to be such a fantastic world. That's unfortunately people that are not serious. I believe, though, that there are some signals that we get from how the coronavirus impacted our mobility, how the coronavirus impacted the way we trade, the way we connect, that will certainly call for some type of upgrading and updating of the situation. That's for sure.
Thank you, Ludovic. I think many people agree with you on that. Bettina, one big question. Do we need a new social contract?
It's one of my proposals and of my really dear topics. I think that we have a world that is composed of civil society, governments, science, beliefs, and to come together and to live healthy together, we have to know how to live together. And I think that the nowadays societies on a global level have to make a new contract, because the nation boundaries, as we know, don't mean anything to diseases, but also the levels of society should not be the leading guide. So what I would like to see is a kind of new social contract where we all subscribe and say, if we want to continue to live together peacefully and healthy, we have to be at least d'accord on some rules, common rules.
Well, it sounds great. I would sign it definitely. And just wondering, is the UN, the United Nations, as an organization, together with the, for example, WHO, in the power level of creating this social contract? Would that be a thought leader and creator of this contract? Even though the WHO faces a crisis right now as well, with some members, bigger members, leaving.
The multilateral organizations like the UN system are important. They are the only multilateral construction we really have. We have others, groupings. We need them, but we have to change them. They date from post-Second World War, and our world has changed. We have to adapt it to today's reality. For example, these are nation-state organizations, and the political leaders of nation-states are not the only ones in society. So we definitely have to adapt the system, but to renovate it, not give it up. I know there are a lot of critiques about UN. I hear it every day, but this is the starting point, and let us get it up to another level and integrate the parts of society into the multilateral system that are not yet represented.
So the multilateral system you're talking about and the social contract, could that lead to a new climate contract, which we need? Is corona, the COVID-19 virus, maybe a catalyst for that change that needs to be done?
Thank you for this question, because it shows that we have to go, and what public health people try to do, to go out of the box thinking. There is not the box climate and the box health and the box politics. It is interlinked. And we have to start to work in systems thinking. And I think also in these terms, COVID was an eye-opener. People understood more and more the interconnectivity, that trading things from here to there that can be produced locally is not necessary and is even bad. That the things between climate, health, and economy are closely linked. And we cannot just go for one thing and the other is just left out. We have to do systems thinking approaches. And that's, I think, what the crisis now tells us.
Big tasks ahead for you and your association as well.
Yeah.
If we get down to some of the burning questions society has right now, it's all about the testing and vaccination. Could you give us a brief update on where do we stand? How do we actually supply testing for everybody? Is it necessary to test everybody? Is the vaccination to come this year or next year? What is your latest news on that?
You asked the crystal ball question. The crystal ball question for the vaccine, one answer is biologically it's possible to do and to have a vaccine. We don't know when it will come, but as there is a lot of impact and a lot of also political will, think of the accelerator action from the EU now, collecting the money to get everything done as quickly as possible. I think we will have one, but we do not have the solution with the vaccine. Then come the real public health questions. Who will get it? Where will it distribute it? Which other people at risk should have it? Do people want to take it up? Think of all the anti-vaxxers who say, no, never any vaccination. As I said, we have to get the population on board to make things happen, because the technological fix is one thing, but people are the most important. And you also, vaccination is one, and then you asked testing. Testing, yes, for sure. How do you want to know if someone goes into a nightclub, infects X people, and these X people go to other places? How will you know where this all goes? To protect those who were not at the nightclub, you have to make a series of tests, and it's one of the best ways that public health can do in infectious diseases. Know where it goes, where it is. It's also good for those who have not been infected.
Do you have an example of a society, of a country, of a government that is, during this crisis and also in the development of a social contract doing very well?
Well, we do see things coming up that are very interesting. It's interesting that the countries I would think of in the first place are led by women. I think of New Zealand. I think that Jacinda Ardern, already in the crisis of Christchurch, was definitely taking political action by saying no more automatic fire guns a week after the Christchurch attack. And she was also one of the first to directly take measures of public health. And she takes a very interesting word. She says the politics of New Zealand are politics of kindness. Kindness. Not economic growth, kindness. And I think of practical examples like Finland always is a public health laboratory of the world. They always start with interesting things very first and then others come later. Well, they were asking if the basic income would be a solution. They're trying it out. They think about a different work-life situation, working less during a week, having more time for the so-called unpaid work. I think there are possibilities and moves to new solutions, and we have to follow them, and we have to see what we can take. We can never transplant an example from New Zealand, let's say, to Colombia, but Also in Colombia, there are interesting things going on. The new mayor, Lopez of Bogota, she is an amazing person. And mayors, as we have seen, of big cities are very important in their activities for health, for climate, and for the whole well-being of society.
Thank you once again, Bettina. To know how to preserve the well-being of societies, we need to know where COVID-19 comes from. So, our audience, what do you think? Where does it come from? We have our Slido slide up. You have about 30 seconds to vote, and would be very interested to see what you're thinking of. Sorry. So, climate change, disturbance of ecological balance seems to be on everybody's mind, followed by globalization, and it's what it is, a recurring situation. We'll just give it another 10 to 15 seconds. Looking forward to your inputs. Thank you for your votes. We see that the climate change is definitely on top of people's minds. Ali, all our speakers are with us, and we're looking at your questions coming in. Thank you for that as well. I would like to ask Ali Mobasheri to give us some of your views, share some of your views on the results, climate change, globalization, that as the reason for COVID-19. Do you agree?
Excellent question. Yes, I do. I think you have to think about drivers of the changes that we see in our environment. I believe that it's globalization, urbanization, industrialization that's resulted in so much drastic change in a short period of time, which has led to acceleration of the possibilities of viruses jumping across species. So I would agree with the audience and those two top responses.
I'm glad to hear. So there is actually a chance to change something if we work on the way we globalize and the way we treat our climate.
I think we have little choice now. This has been such a disruptor to every aspect of life. So I think change is here. I wouldn't call it the norm. I would definitely agree with Cobi. I resist the idea of calling it the new norm. But I think we just need to be better prepared, more proactive, and more able to put in place plans and mitigation processes for the next one. And the next one is potentially around the corner. We haven't got out of this one yet, but the society, the globe that we live on has not suddenly changed in the last 6 months. Of course, travel's been reduced, and there are efforts in place to stop the spread of the virus. But we still live more or less the same way. It's behavior change. And I think we can go back to the concept of behavior change at a societal level.
Our audience has the choice now to give us an idea of what they think, how we can prevent the next pandemic as well. You gave us a couple of keywords as well, thank you very much. But we put up our next Slido to give you the opportunity to let us know what you think. So please go onto your Slido page and give us your idea. About 30 seconds you have to vote. So the dominant one, number D, this internationally binding standards and protocols, is definitely heading, followed by redefining our economical values. So we give it another 10 to 15 seconds.
It's interesting the participants are changing their mind between those two options at the top.
Absolutely. But still internationally binding standards and protocols. That's definitely something. So I guess we close the poll now. And I wonder Bettina, what do you think about internationally binding standards and protocols? Is that possible?
Well, I first of all must say that all those who voted, they're all correct. There is, first of all, there will be always pandemics around, history has told us, but perhaps the speed that we see pandemics coming up now is a little bit faster than before. And yes, we do have international health regulations. They exist, they have been redefined 2005. I think we will go again and look at international health regulations. But in addition, I would like to come back to what has been said by my two colleagues. Every pandemic changes our social behavior. If it was the Black Death, or think of AIDS. AIDS, at the long run, has changed a lot our social behavior. If it's not directly today, but at the long run, we will see that also COVID will have changed our social behavior.
We definitely get back. I'm sorry to interrupt, but we'll definitely get back to that in a little later, because we have one poll open, one question, and this is actually, what do you think when it comes to international binding standards? What do you think about a new association on pandemic preparedness and prevention? Would that be something you would support?
Oh, I definitely would. And I would like to include all the people who should be in it.
I wonder which those are. I'm going to come back to that later. But asking our audience now to give their opinion, what would a Pandemic Prevention and Preparedness Association do? What is their role and what could be achieved? Please vote now. You have about 30 seconds. Thank you. So we're again international networking and knowledge exchange, very important. So it could be the body to lobby for standards and protocols worldwide. I'm glad to read that there is only few people thinking that there is no need for such an association. So we take another 5 seconds for the last votes to come in. And I'm wondering, there is one expert when it comes to the association field among us, Cobi. Cobi, what do you think? Would you like to head the new association of preparedness and prevention?
Certainly. Let's say I think that I will refer to this poll question, but also to the two poll questions. There is no right answer, and there is no one good answer. It means that if we only have protocols and rules, we have a lot of rules nowadays, but that will not be enough. If we will only exchange knowledge, that will not be enough. If we will only involve the epidemiologists and virologists, it will not be enough. So the cause of the pandemic, as Bettina said, there will always be pandemics, is not only globalization, is a multiple aspects together that influence everything. And the same go in 1918, we had the Spanish flu. And if you look at pamphlets that were at that days and the rules that were take good hygiene, use face masks, etc., etc. It's the same as what we are doing with COVID, actually. Not a lot is changed in 100 years, and the same goes for association. If we will look on only one aspect, we will not succeed. We need to be interdisciplinary. And in the association, this is a possibility to bring all of them together, and all the existing structures like the World Health Organization of the UN go with time and change it, and we need to work together. We need to have the medical science, and we need to have the economics, and we have to have the sociologists, and we need to have the psychologists as well, because we need to look what is needed, what we need to achieve those things, and how to achieve those things. And how to achieve is connection together. If everyone will be in lockdown and economical bankrupt all over the world, we will not have the finance to exchange knowledge and to make the changes. So we need to work all together with new standards, with new norms, an association of the rules to bring all those experts together. And what will change is that before the COVID, we could stay in a meeting 360 days a year, except of Christmas and New Year's or other religious holidays. All the years you could have meetings. Nowadays, we travel less, which is very good, less pollution with airplanes, etc. And we do a lot of meeting through the digital way, but I still hope that everyone will bear in mind that the physical contact, and I'm not talking about sexuality or intimacy, but face-to-face discussion of important things can make change, because the virtual way is different. And you see nowadays that the youth are connected to smartphones, smart apps, etc., forget to express emotions, and emotion is also part of change that we need to have in the society. So all those aspects need to be taken into account to achieve our targets. And equality of the issues, if we will only take one part and the other part will suffer, we will not get to the point that we want. We always need to think about win-win situation for everyone.
Cobi, sorry to interrupt you. I tried several times. I know you're really passionate about this field of meeting, and I'm glad to hear. Just imagine you being the president of this new association. Would you accept Ludovic as the chair to get the resources bundled and get it going?
Why not?
So let's talk to Ludovic about this, definitely, because Ludovic actually, when we talked to him before, he said he talked about the 50 shades of COVID-19, and I'm wondering, what's in it, what's in the 50 shades of COVID-19. Ludovic, could you give us a bit more, insights on what's within the 50 shades?
Am I president of the alliance already or not yet?
You're the chairperson.
Depending on whether I'm appointed, I'm the chairman.
We're discussing this
thank
still.
you very much for the
okay. So where do we stand right now?
So it depends on who votes. It depends on who votes. One of the issues we faced with the COVID-19 crisis is it all boiled down to a coalition of the willing, and we saw very vividly the questions about the WHO and the politicization of such organization, but also the funding. WHO budget is ridiculous compared to the amounts of money that were put on the table to fight this crisis. So for me, one of the bigger issue right now is international trust when it comes to this, when it comes to data information and analysis, when it comes to standards of policy response. But as the financier of the group, I'm always very concerned about the fact that we, the World Bank worked with pandemic bonds, but, I don't know if you've understood what happened in the end, but it's very difficult to structure those impact financing vehicles that enable to have a rapid disbursement of such funds should there be the next pandemic. And we've, in some countries in Europe, but also in some emerging countries, we still continue to see that there is investment in fighting the pandemic, and the look at climate change as a global issue. There is still massive underinvestment in the prevention side of climate change. So for me, blended finance, so the ability of the public sector to incentivize the private sector to kick in, the risk sharing between the private sector, the public sector, and certainly, why not financial markets, is going to be one of the biggest concerns of this alliance, so that this alliance has a weaponized arm, which is to be able to very quickly deploy. I don't know if we need the blue helmets of the pandemic, but clearly, professional health teams were missing in action in so many countries in the beginning of the pandemic. I remember very vividly the images of Italy being overloaded with cases at the hospital. So, if for something as global and as systemic and exponential and critical as pandemics, we cannot sit around the table. I don't know for what we can sit around the table.
So how successful are we yet with fighting the second wave? Where do we stand concerning to your data you're actually looking at every day?
Well, it looks like, at least on the stringency of measures taken, most countries have now understood that the mask is useful, which in my region of the world for quite some time, it looked like, masks were useless when Asia was quite successful with masks. We still have some behavioral change communication to do because people don't necessarily want or understand why the need to take distances. And we've seen this resurgence of the number of cases in Europe, the very high plateau in the States, and certainly some of the very difficult situations some emerging markets are in. So I would say, the big question I have as an economist is whether living with the virus is, something we can do, meaning what types of income losses it incurs to some of the most vulnerable of the population, because we're going to be, just think about the hospitality sector, restaurants and hotels and events and just clubs are closed all around the world, and people are working in these sectors. So I don't know how we're dealing with fighting the pandemic. I see the number of cases increasing every day, but I certainly know that we will need to live with not necessarily a second wave, but a high prevalence of the virus in the general population till we get a vaccine.
There's a question from the audience to you. Please stay tuned. I would like to, before we put that question on, I'd like to give Bettina, Ali, and Cobi a short, couple of seconds to give their point of view. What is the state of the second wave right now, in your opinion, and are we successful to fight it?
Well, the second wave will be different from country to country, as we know. We are in some countries in the first wave and still not yet over. We may also come to a situation where we have small little pop-ups, and we may have other places where there is a real second wave. So this will change from place to place. And I think that public health people are prepared to both scenarios.
Thank you so much. Ali, would you like to give your comment? What's it like in Great Britain, where you're at, and what is your opinion?
I would agree with Bettina. I think there are going to be, I think it's going to be a flatter curve. That's my prediction. It won't be as dramatic as the very first wave because humans have not been exposed to this pathogen before. The fact that there are now measures in place, masks were discussed, Ludovic mentioned clearly, we need to wear masks. After all, this is a respiratory disease. It's a virus. It's passed on through droplets, and we know it's airborne in that regard. So I would imagine it would be flatter, but perhaps longer lasting. My concern is the seasonal flu is also around the corner. It's just a couple of months before I actually received my own flu injection because I'm an asthmatic. So I think if you think about the approaching autumn, especially in the Northern Hemisphere, for us, it's going to be a challenge with COVID-19 and the flu virus.
Okay. Thank you. Thank you. And Cobi, what is it?
I would like to add one thing on that. it seems that the second wave is more local, with difference in patterns between regions, cities, countries. Nowadays in Europe are more young people who are getting infected and less the elderly. But it's very important to realize, and that will be a very important measure, which conditions are needed for the people to keep the measurement that are needed. That's something that governments, politics need to think very careful about, because it will not be endless that we will keep people away from the hospitality branch, from getting out, for interacting with each other. We need to give them the possibility to keep going on with the measurement, like mask and distance, etc.
Thank you. Could we now go back to Ludovic for the question from the audience? I think this would round it up really nicely. So how big is the possibility that the virus, COVID-19, is created on purpose? This is definitely a big question that I actually wanted to touch on later. But I think, Ali, would you like to start on this? Because I know you have a quite decent opinion on this and knowledge, especially.
Thank you, Kate. Highly unlikely is my immediate response. We have the sequence of the virus, and if you are looking at a genetically engineered virus, there will be characteristic signatures in that sequence that tell you it's been manipulated. I don't think there's any evidence that this is a lab-created virus. It is potentially possible that it's incubated in a lab. It's, I think it originally came from the wild. Maybe it was in a carrier host in a laboratory setting. But if I understood the question correctly, I think the question is about whether it's created and synthesized. I don't think that's the case.
Thank you so much for that sharp answer. If anyone likes to add something to it, we could take another round, but I think it's not the time maybe to dive too much into this topic, because there were lots of thought and lots of questions around the World Health Organization, its role and the way of communicating. So, Cobi, with the World Health Organization, did it change since the outbreak? Did the criteria change to identify epidemics and pandemics earlier and prevent them?
I think that the World Health Organization, after the beginning crisis in the beginning of the pandemic, changed some policy. But still, personally, I have criticism about it, because the intention are good, but the intention is not enough. There are still countries who are not members of the World Health Organization for unknown reason. This is unacceptable for a World Health Organization. Everyone should be part of the organization. It should not need to be colored by any politics, because it's about health and human rights. And putting statement is not enough. It's important to deliver information as soon as possible, uncolored, objectives as possible. And I hope that they will change the way in that respect. I didn't saw it yet. What I did show from the World Health Organization is the tremendous effort to deliver as much as possible information to everyone concerning the scientific development that we have right now. But still, we are lacking measurement that will be available for everywhere around the world. The bright side of COVID, there is always some bright side of things, is that finally, healthcare professional, politics, economics, pay attention for infectious diseases. And that's very important, because for years, malaria is still going on. For years, we have a lot of other infectious problems that we didn't tackle in the world. So nowadays, this get infectious disease on the agenda, which are very important.
Very important.
I would agree with Cobi, definitely. I just want to jump in and say, here we have a situation where the United States has proposed, the leadership of the United States has proposed to take away funding from the World Health Organization. I think it's exactly the opposite we need to achieve. We need to increase funding for this organization, give them more money and more resources. And as Cobi correctly pointed out, those countries who are not members, why not? Get them involved. Nobody's going to be immune from the rest of this ongoing pandemic and the next one. So increase membership, raise further awareness, and give more money to those organizations.
What a good point. Funding public health better is definitely one of the main focuses you're looking at, Bettina. Could you please give us a status on the health of the public health system?
Well, I may come back to the question of WHO.
Please.
And add up something to both what Cobi and Luda said. The problem with the current international health regulations is that it's UN, that it's the member states allowing or not someone to enter to get the information. So what we need is a better enforcement and a better implementation. And yes, I can just say everybody has to be member, and we have to support WHO as the multilateral organization. We have to support multilateralism in general because viruses and bacteria don't respect borders. We cannot split, I said at the beginning, we cannot split societies, we cannot split our world in those who will be infected and the others who will be not infected. So if we come to public health, a lot of countries have discovered that they have a very strong clinical care system, but that their public health was underdeveloped or underfinanced, and intentionally so. So now I see a positive move in a lot of countries financing their public health systems, but also others who continue to not finance public health. And this should be changed.
So is public health actually better funded from now on? Is that a fact or is it a wish? In some places it's still a wish. I think we have to pressure for it. We also have to pressure for the so-called essential functions, the healthcare workers, not only to be applauded from balconies, but to be better paid, to be better valued, and to be the people they need to be. And a lot of places, I mean the 75% of healthcare workforce and public health workforce are women, usually underpaid, usually not very well recognized, and we have to change that in general. So I hope that COVID will change the fact that we understand that essential functions are really essential. Yeah, absolutely.
Kate, I would like to add something to Bettina. I heard a few times about women, men. Again, I don't want to split it, not for countries and not for borders and not for gender. I don't care if it is male or female. The measurement of welfare countries is healthcare and education. People work very hard to deliver important issues, and in healthcare and in education, we need to really support the top people to go there. This is very important. And we should not forget that we need to go back, certainly in the Western world, in Europe at least, to production. We should not be dependent on others. We should produce by ourselves, so we will have enough money to support the importance of education and health.
We call that localization, Cobi.
Global, yes.
Yeah, global.
May I react on Cobi?
Please.
I'm the one who says do not split. So I say do not split. We have hundreds of categories. We can split by age, by color, by religion, by nations, and I heard that from Ludovic, by science and business. No communication between science, politics, science, business. Very, very dangerous split. But I do think that the split in gender, it also reinforces what you said. We need education, but for all of us. Still, the 51% of the world, the women, are treated like a symbolic minority, and I think that's a bad split, because we know that in places where you treat women equally and have them their dreams realized, everyone has a better life.
Absolutely. Better life is definitely a very good point. And it's really like keeping the social distance, but moving together and working. Also a good point, the virus is not looking at borders and you know, it's just spreading. There is a question from the audience actually, which I would like to give to Ludovic. Was it the right decision for the countries in Europe to each handle the pandemic separately with closed borders? Would a global approach, or at last a European approach, be less damaging to important sectors, for example, travel, and reduce the risk of using the pandemic as a political instrument? I think with the data you have and the experience of the last couple of months, Ludovic, could you please give us some insights on that?
Sure. I mean, the beginning of the response to the pandemic was catastrophic when it came to coordination. We did close borders and we did, forbid masks exports from one country to the other. So that was really, excuse my French, a shit show. But the second part of the response was much better. I think Europe really rose to the challenge in both the funds that they made available to respond to the crisis, both from the monetary policy, so the European Central Bank, but also from the fiscal policy with the pooled debt and subsidies instruments. So can we do it better? Yes. Should we have a BARDA, like a region, like a health institution to finance innovation and to make advanced orders of vaccines like the US? Yes. Should we have a stronger commissioner taking care of health services throughout the commission? Yes. But again, institutions are evolving only from crises, and clearly on health, the European institutions were not ready. But I personally feel that, though we even now have haphazard reopening and the tests and the quarantine from one country to the other is not nice, but most of the countries also do it between regions of the same countries. So to a certain extent, I have the impression that we went to a more, I would say, a better handling of these light lockdowns. But let's not forget that in the end, I think Europe is very, at least is aiming at a principled recovery. I think Europe will learn from this crisis much more than, say, the United States or China. And so let's not throw the baby with the water bath, the bath of the water. I think we did good. We could have done better. Clearly, I would have preferred the European Commission President to tackle the issue heads on instead of receiving Greta Thunberg or President Erdogan at the beginning of the crisis. But that's for a different debate. So
I have three keywords for you, Ludovic, to react on, which is data crunching. We talked about this, the blockchain and duty of care. Duty of care of employers, but also event organizers. What is your opinion on these three, and what is the role within the pandemic prevention and preparedness?
I mean, the first two topics, I mean, for us as economists, it was a realization that we had a lot of data to understand, to take the pulse of the economy almost in real time. But if I bundle the first and the second keyword, the big issue for me is, what type of tracing are we ready to do to answer to the next pandemic? I'm not a medical doctor, but anybody dealing with infectious disease will tell you it's about testing, isolating, treating. And we haven't been really good at isolating, or we haven't been really good at making sure that the testing was widespread and contact tracing, for example. So the privacy of data and anything related to health data, we are very far from having standards and having the necessary, put the necessary trust for people to make sure that it is for their own good, because they're used to platforms that are very cannibalistic or that are very data, hungry, and that, somehow are not necessarily doing good with this data. And people don't understand that the data has power. And in the health system, it's something that I think will come to our mind much more after this pandemic. On the last one, duty of care, I think for the businesses, a lot of businesses have been calling for responsible capitalism, sustainable capitalism, a principled recovery. I can see that a lot of them are walking the talk, especially when it comes to making sure they protected their people. And it was not only for reputational risk of having a cluster in the firm, but there will be more questions coming our way on the rethinking social protection and relation and the future of work. Thinking where does the duty of a company stops and what does the duty of the government starts, on top of the duty of one person to take care of himself or herself on their own. And this is something that's going to create a lot of certainly Harvard Business Review articles. But, for me as a manager and working for a global company, I've been impressed by how my company trusted people, local management, and made sure that we were empowered and protected at the same time. And I hope that most people in companies had the same, awe for the company. I unfortunately think it was not the case. I was particularly surprised from the startup scene. The Silicon Valley, for example, was one of the first ones to let go of their people when they were supposed to be all kumbaya and social responsibility, just a few weeks before the crisis hit. And so I think it is about standards, and it's not necessarily the WHO, but it's right across the street with the ILO. So maybe the ILO will have to think about what is the responsibility of the firms when it comes to this large covariant risk like pandemic.
Thank you so much, Ludovic. Bettina, would you like to add a short note on that?
I think that Ludovic mentioned the importance of social systems and social security, and we have seen that in addition to health systems, the social security is very important. You cannot put people in lockdown if they have no ways of earning money for the next day. So social systems have to be looked at, and there is another word that came up with Ludovic for his alliance group, but from Cobi with the personal relations, that's trust. And I think that is also important, that we need trust in the local, in the business, but also among nations, among countries. And that goes back to the political reaction and the multilateralism. We will work together if we trust each other. And so we have to establish trust. And it took a little bit time in the EU, but I think we are on the way, and we see a lot of positive actions.
Some words of relief, finally. Thank you.
No, but we have seen a lot of positive actions. Right. And I think trust building, as we heard from the business, as well from the family or the local point, is extremely important. If you live in a country where you trust your political system, you will follow if they start to implement, let's say, a vaccine. If you do not trust them, you will try to not even answer. And it comes back to the people voting on what I say if I'm positive or not. You will say it if you trust your family, if you trust your system, if you know I can say it.
If you're safe and sound. Yes,
safe and sound.
Thank you so much. Time is running. I'm so sorry to interrupt you, because I know we can talk for maybe on the second pandemic table. We have an audience question, actually. Let's see for whom. Do you think information transparency is important, or you think that should be partially confidential? So who would like to give a statement or two on that? Again, we were running out of time. I hope everybody is still enjoying it.
I will answer very short.
Short and sweet, thank you.
Information should be transparent to everyone as much as possible, certainly about health, and that connected to what Bettina said, trust. With information, you build trust, and this is crucial. So I totally agree with what Bettina said. Trust is very important measurement that need to be done, and information will higher the information and education, better people comply with what you ask them to do.
Right, thank you, Cobi, thanks. Is that your opinion as well, or do you like to add something?
I think that transparency is one point that helps to create trust. But if it comes to personal data, we have to make sure that the personal privacy data protection is maintained. And I think the whole thing, and what I really think has to be said here, is this is political action. So Einstein once said, politics is more difficult than physics. We know it's difficult, but that's what we have to do. It's political action now to create these systems and these trust-building entities.
You know, I take this as a final point and to wrap up. I can't do it better, actually. Thank you so much. Thank you so much, Bettina. Thank you so much, Cobi. Thank you so much, Ali and Ludovic, to take the time today to speak to us and speak to each other. It is a great pleasure. It just leaves me with some closing remarks on this first PanPref first roundtable, which we had today. We truly hope you have enjoyed this exciting, insightful exchange today. More topics related to pandemic preparedness will be addressed in the upcoming roundtable edition, similar to this one. They are going to include technology, globalization, logistics, hospitality, and many more topics, especially on the ones you asked us about today. Once the global situation will allow us to travel again safely, our aim is to organize a face-to-face and hybrid conference. At this conference, industry professionals will meet interdisciplinarily with scientists and economists to define new standards, new protocols, and new economical values like you voted for. This conference will showcase the latest innovation, most recent developments, update you with the newest research, and last but not least, create a platform where we can network, exchange ideas, and together build a sustainable and secure legacy for the next generations and the meeting industry. Several cities have already expressed their interest in hosting this conference. Don't hesitate to contact us via the email stated on our website. Feel free to send your ideas, your thoughts, and how you suggest taking an active role to support this initiative. We look forward to reading from you. Esteemed audience, nevertheless, physical distancing is important. Let us join forces to make a change. Thank you so much for joining us today.